Hi, I'm Dr. Patrick Foy, MD. I'm the director of the Coccyx Pain Center, or Tailbone Pain Center, here in New Jersey, United States, online at tailbonedoctor.com. And this is the next in a series of videos, just going chapter by chapter to provide a glimpse at the content in my book, Tailbone Pain Relief Now. And in this video, we'll look at Chapter 2, which is symptoms of tailbone pain or coccyx pain. And the idea here is that there's lots of people who have coccyx pain or tailbone pain, coccydynia, that don't actually know that that's what's causing their pain. People are not familiar with the anatomy. Unfortunately, lots of doctors are not familiar with the anatomy. So people go on suffering, and they know that something is painful when they're sitting leaning back, when they go sometimes from sit to stand. There's a whole variety of symptoms that are common. But unless they have a doctor that actually examines them properly or takes a good history, or unless the patient themselves is familiar with the anatomy, they often may not realize that the pain is coming from their tailbone. The tailbone is located, here's the spine, this part's the sacrum. The tailbone or coccyx is located, right down here at the lower tip of the spine, below the sacrum and just above the anus. So the patients typically will have pain in that location, as shown in the illustration here. And again, that pain will be worse when they're sitting, leaning backwards, and for some people with sit to stand transitions as well. So really, that pain while sitting is a classic symptom of tailbone pain or coccydynia. So that should be a big clue, pain down at that lower tip of the spine. And sitting leaning forwards or sitting leaning towards one side or to the other side, that will often have the pain feel a little bit better because it's taking some of the pressure off of the coccyx while you do that. That can be another classic finding with patients with tailbone pain. You can have tailbone pain that travels to other body regions as well, but that's far less common. Usually it stays relatively well localized at the coccyx or at least in the immediate area thereabouts. So that's a little bit of a glimpse of what's in Chapter 2 within the book, Tailbone Pain Relief Now. For more information, you can find me online at www.tailbonedoctor.com, or if you're interested in getting a copy of the book, either the paperback copy or an ebook copy. The ebook copy you can get worldwide. The paperback copy you can get worldwide through international shipping, or you can have it printed directly within the United States, Canada, the UK, Europe, etc. And more countries are growing onto that list. The best way to find the book online is just to go to www.tailbonebook.com, and on there I'll keep all the links for the different Amazon pages within the different countries and such, so you can find the site that works best for you through that at tailbonebook.com. Anyway, I hope that's helpful. Definitely post your questions or comments down below about symptoms of tailbone pain, related to this chapter, and I'll try to keep up on those, answering your questions or comments if you post them down below this video. All right, bye-bye now.